I think one of the really big challenges that we have are, well, I'd say there's two. They're kind of related. The behavioral health crisis does not abate, and we've begun to build out our facilities, but it's taking time to implement the plan that we worked on with Governor Inslee a few years ago in terms of more community-based care. And so that challenge, as we look at community-based facilities, a new Western State Hospital, the behavioral health teaching hospital that's opening up in North Seattle, those things are going to help, but they're not going to happen immediately. So I think the legislature is going to have to figure out how to respond in the interim while those systems get up and running, and we have a more workforce and more options for people who are suffering on the street. So that's one. And I think secondly, one that I'm really excited to see how the legislature responds is how we fund expansion of coverage under the Affordable Care Act and through the Health Benefit Exchange based on the waiver that we just obtained from the federal government. Those are things that I worked on in my time in the legislature through Cascade Care, and then also in the funding as well for state-based subsidy options. And so I'm really excited to see how that plays out, and I certainly hope that they'll continue to fund it. I think that we have done the right things over the last decade to expand access to coverage, which was one of the things that I was really focused on when I came in 2011 through our expansion of the ACA, Medicaid expansion. We passed the Medicaid expansion in Washington State with bipartisan support. I mean, imagine that. That was in 2012, and some states we can't even get that done. Yeah. But we did that 10 years ago, and we've also implemented really well all aspects of the Affordable Care Act, in my opinion, in terms of expanding coverage. So our coverage rates are really high now relative to what they were, just a dozen years ago, where the 15% unemployed. But we have fallen down. There's no question we're behind on where we need to be on behavioral health access. I think it's important if you really want to get around on these issues and get knowledgeable, you have to listen to where everybody's coming from. And usually there's some truth, if not 100% truth, in what everybody's saying. And I think you've got to be flexible in that regard. And that's what makes it a challenging policy area to work in.